Here is what I do as a nurse case manager that does not work in the hospital setting. I am a case manager who works in the public health system. Hi, welcome back to my YouTube channel. My name is Brianna, your nurse career strategist, nurse innovator, and dream facilitator. And in this episode, I want to talk about nurse case management. Now, when nurses hear case management, there's a very common picture that comes to their mind. And that's typically the nurse that's working in the hospital that comes to the unit during your shift to manage certain social services, psychosocial services, or discharge services when the patient is getting ready to leave your unit and be discharged home. You might also think about a nurse who works for an insurance company. They likely work from home and are doing something like utilization management, chronic care management, or just case management in general. So your thought is they're either in the hospital, they're working from home, or they even drive into the office, they're in the corporate setting, and they're doing case management. Myself as a nurse case manager actually does not operate in any of those settings. Yes, I am a nurse case manager who's been working in the public health system in your local community health department. This is an area that I've talked about before. It is not a topic that I go into in depth because for some reason, the public health system doesn't seem to be the sexiest topic amongst us, I think, as nurses or healthcare providers. And that's possibly because in the public health system, they don't tend to pay as much historically, or it's really harder to get in because there are nurses that are in that setting that have been there for a long period of time and are likely there until retirement. But I will say that I have enjoyed being able to apply nurse case management principles to patients that I've seen in the local health department. So there are several opportunities for nurses who are interested in nurse case management in this setting. This could look like managing patients in a maternal or child health program under children's medical services or under infectious diseases. These patient populations are likely in need of chronic care management, specialty diseases management, or need psychosocial services and any other ongoing education related to health. Public health systems also use nurse case manager services in homeless initiatives, substance use programs, correctional, public reentry programs, severe mental illness support, and aging and disability services. These are areas I'm not as familiar with, but they are patient populations that are vulnerable populations and addressed by the community. Working in community health or public health can look like working under a federally qualified health center, a local health department, a federal agency, or a state agency. My particular area of experience has been in tuberculosis. This is TB, an infectious disease that still exists not only inside of the United States, but also commonly outside of the United States. These are patients that can be treated for active disease anywhere from 6 months to a year or more, depending on their strain. So in community health programs, jobs that are posted may not always say case management nurse, but it is maybe quite often that as a nurse who gets employed under a public health nurse title will be able to exercise the types of activities that a case manager typically is providing in both coordinating care and overseeing a patient's progression of treatment from beginning to end. So these are other areas to consider if you are in the hospital or working at the bedside and considering other ways. I'm passionate about helping nurses connect the dots to where their clinical skills and their inborn natural ability to project management, lead, see gaps, and fill gaps can take them outside of the traditional nursing space. I have a link in the bio that will take you to the Nursing Next Navigator. This Nursing Navigator will give you insight into where you are right now in your nursing journey and what may be a good pivot for you towards a non-traditional nursing opportunity. You'll also get customized feedback based on where you are now and actionable steps to be able to take your next step towards your next dream role or your next nursing position. That's all I have for you in this episode, guys. I'll see you on the next one. Bye.